technology is changing. So we're now getting into tightening, and we're getting into actually being able to lift the skin, where we don't have to go in and do actual plastic surgical cutting. It's not going to replace the plastic surgery when you eventually need it, but we have ways now and devices that are going to really help make you appear a lot younger and rejuvenate your skin. We take lasers and lights and we treat psoriasis. We treat vitiligo, which is a pigment loss condition. And we even treat stretch marks with machines, white stretch marks that can repigment the stretch marks. We have machines that can take the red out of the stretch marks. So again, the gamut of what we treat is huge, and we're still learning. We can actually grow collagen under the skin. So we have devices that will actually help that as well. So we can make some wrinkles go away, we can make acne scars go away, chickenpox scars, those kind of things that were really hard before that. So that's the rejuvenation market. We have other lasers that we use for red spots. People have little red moles called hemangiomas or angiomas. They have port wine stains, spider veins on the face, little broken blood vessels around the nose or other places on the face, even leg veins. All these devices have progressed over the years. The technology's progressed, and we've been working with companies over that period of time as helping develop, helping to test those devices in our research center. We have devices that make pigment go away. Sometimes people have brown spots, mainly on the hand, sometimes on the face. We can destroy the pigment, leaving everything else in the skin alone. We can make tattoos go away. I always tell people it takes a lot longer, it's a lot more expensive to remove a tattoo than to have it put on, but we have devices now that can go in and actually remove the pigment without touching the skin, and if done correctly, not even scarring the patient and just making the tattoo disappear.
Dr. Gold is internationally known as an innovator in photodynamic therapy. And what is that exactly?
Photodynamic therapy is a term that we use to describe the use of a photosensitizer, something that's going to sensitize your skin, and then a light source. It's actually over 100 years old. It's been popularized in the last couple years by a group of us that have been able to look at the product and the different lasers and light sources that now exist on the market and say, well, how can we make this stuff work to treat certain skin diseases, and then how can we make it work in a cosmetic arena? It came out as a medicine in this country to treat what we call pre-skin cancers, little rough red spots that people get on their face and on their head. And we put this medicine on, and then we let it sit for a while and put people into a light box, basically, which was called blue light. And we found that all these pre-skin cancers went away. And then when we asked our patients what they thought of their skin, they all said, our skin looks better. We actually feel different. It's smoother, it feels better, but the therapy needed to evolve. What we found is that we can make the pre-skin cancer actinic keratoses go away, rejuvenate the skin at the same time, and maybe, and this is not scientifically proven yet, but we may be able to use this as a cancer prevention if we treat people and follow them long enough and see if we can actually reduce the number of skin cancers some people get over their lifetime. So that's something that actively we want to start looking at. There are lots and lots of lasers and light sources on the market. And one of the things that we pride ourselves on is that we always have the latest in the technologies that exist, because one machine or one device doesn't usually work for all the conditions. So if you come in and want a laser hair removal, I have many different devices that I can use for that, same with photorejuvenation and so forth, because we want to make sure that we tailor the right machine to the right patient. So we're constantly bringing new devices to market, working with companies to make sure that the machines that we're getting are actually working, doing what we want. We're doing the science to make sure that they do all that and so forth. But overall, our patients with our new lasers and lights, rejuvenation gets better faster than traditional lasers and lights. Acne gets better faster than traditional medicines. And so it's been really nice to be able to